Hello, Gold viewers. I'm Fiona Langsharp, IBCLC Public Relations Manager and MC for the Gold Perinatal Online Conference for 2015. Welcome to my interview with Christine Kowaleski. Hi, Christine. How are you doing today?
I'm doing well, Fiona.
Good. Well,
How are you?
thanks for taking the time to come in and visit with us today. And we're just going to I'm going to drill you now, Christine, with some questions, and just so that you can tell us a little bit more about what's happening. And I'm excited. I looked into your presentation already, and I just thought it makes so much practical sense to me, but I don't know a lot about it, and so I'm excited to hear more what you have to tell us. And for our listening audience today, Christine's going to be talking about holistic management of the drug-dependent neonate. So, Christine, let's start at the top here with this question. When did you realize the benefits of treating the whole family with the drug-dependent neonate?
Well, Fiona, it wasn't exclusively with just this population of babies. Um, I try to treat everybody holistic. The drug dependent neonates have become uh, our census has become higher and higher. So the percentage of babies that we have in the NICUs now sometimes range up to about 10% of our babies are drug dependent neonates. So we had to transition this holistic treatment over to them. And so I would say it was probably in the last 10 years that we realized that, gee, we can treat the baby, but if we don't work with the whole family, then where are we going with that? So obviously, if the baby is drug dependent, there's a reason. Whether the mother is herself in a drug treatment program and methadone, whether it's chronic pain. But regardless, mothers always feel very guilty about the fact that their baby is in the NICU for sometimes an extended period of time. So in addition to the fact that once the baby is well enough to go home, they're still very, very fussy babies and they need a lot of attention. So, in order to make a transition to home, we have to work with these families and what, you know, strategies on how to care for their baby at home. It's not the same as if they were taking home a baby that didn't have this past experience.
Hmm.
So it's been evolving over time.
Sure.
I think we've seen that now as the baby comes in, we start talking right away about what the baby needs to do to go home, and we try working with the mom and be very non judgmental of where she's coming from to hopefully eliminate some of those guilt feelings.
Well, it's lovely to hear that that you saw that need to be involved right away, and also that that's how you generally practice. So it somewhat came as probably a second nature, even with these drug dependent neonates as well. Can you go on and talk to me a little bit about when you started wanting to teach other healthcare professionals this type of practice? What have been the highs and lows in just expressing this type of management and care for these families?
So it's interesting because as a nurse practitioner, I was not at the bedside with the babies 24/7 like the nurses are. So when I would talk or teach nurses, the one thing that is challenging is um, people don't like it when they feel like babies could have had a different outcome. So it's working with the piece about the mother has this issue. She may be addicted to a substance. It doesn't make her a bad mom.
Hmm.
So that's been a challenge because sometimes you're working with two people that have defense mechanisms up. The nurse is very protective of the baby, and the moms sometimes are concerned that they're going to be judged, and so they get a little defensive. So that has probably been the biggest challenge. On the flip side of that, I hope, and the feedback I've gotten is that people do have a different understanding of what the family is going through. And I say the family because whenever a new person comes into the family mobile is rocking. And so we want to have some homeostasis with that. And I think the healthcare providers, when they can have an understanding for what mom's going through, and dads and the other children, that it knowledge is always helpful, right? So
Mhm.
the feedback has been good.
That's awesome. That's really nice to hear that. And I'm sure it takes time and patience of others and understanding as they, get to know and understand all the types of relationships that, that we're looking at, albeit involve the mother, the father, the, grandparents. I mean, there's a lot of extended family I've seen involved in these situations as well. So
Hmm.
can you tell me lastly, from your heart, Christine, and I can hear, you have so much passion in this area. What would you like our delegates to take away from this presentation?
Um, I think the most important thing is to to take away from this is to include the whole family and to um, have a great deal of respect and understanding for what they're going through and what they will be going through, um, emotionally, psychologically, and physically. And that will ultimately be the best outcome for the neonates. We know by studies that have been done that developmentally these children um, score on they're pretty much on target at 6 months with other full term babies, unless there's been some really untoward effect. But um, for the most part, the most of the babies we're seeing are the methadone babies, and so what I would hope is that people who hear this talk and say, okay, we're gonna work with this. We're gonna work with the whole family. Um, how can we support the mom, the dad? How can we support the other children in the family? What will they need after they go home? Not just what they need while they're there. And doing maybe even some coping skill teachings with the moms and making sure there's visiting nurse follow-ups, and again that they're also not only the hospital nurses, but the visiting nurses are educated and working with the family system.
Well, thank you, Christine. I just was thinking about all the people that really are involved in situations like this, and how important it is to have that consistency of care provided to the whole family throughout all the stages, immediate care in the NICU, transitioning out, and then at home. So thank you so much, for being a part of this and just, now that you're teaching as well. It's wonderful to know that you're doing that, for our healthcare professionals and people that will be being hands-on with these families. But for our delegates out there, come to this great presentation titled Holistic Management of the Drug-Dependent Neonate. Christine Kowalski will be here, and I'm excited to hear more of what you have to say, Christine. Thank you so much for sitting down with us today.
Oh, thank you, Fiona. It's been my pleasure.
So thanks for everyone listening in today. And as I mentioned, this will be at our Gold Perinatal Conference 2015, our holistic management of the drug-dependent neonate. Thanks for listening in.